My name is Jim Roberts, and I'm an ER physician, currently Professor of Emergency Medicine at the Drexel University College of Medicine and Vice Chair of the department. I'm also Chair of the Department of Emergency Medicine at Mercy Catholic Medical Center in Philadelphia, and I'm Director of the Division of Toxicology at the Mercy System. I started working on it, the first edition, at the University of New Mexico in 1985. It was done on a Selectric IBM typewriter and through regular mail with myself and maybe 15 or 20 authors. And it's now in its 6th edition, where it's all electronic and email and computer-generated figures and so on. So it's had an increase in volume as well as depth, detail. We've increased the procedures a bit, but many of the procedures still remain the same. Well, we have a few more editors. Probably the leading educators in the country are on our associate editor list. Our illustrator is just remarkable. We've increased the illustrations many-fold. We've organized them into specific boxes, so you didn't have to page through a couple of pages to see the sequence. Everything's in one box somewhere. And we just updated any new knowledge. The nice part about a procedure is it doesn't change that much. You just refine it more, and it's a little easier to write than a book on, say, cardiology, where every day there's a new paper out, or there's not too many papers out on chest tubes or central lines. We have, however, added stuff like ultrasound and burr holes and other things that might not have been in the previous editions. I would emphasize that we probably have the leading authorities in academic emergency medicine on our editorial staff, and about 250 authors who are well known in their field to be experts. These are people who really do it and really know it. They're not some doctor who's sitting in his office and because he's a chairman asked to write something and he hasn't done the procedure in 10 years. Our guys and women who write for it do it, and they impart their expertise that way. I just do it because I like doing it. Our authors, I think, and our educators have a flair for teaching, and they're able to impart it. Just because you can do something doesn't mean you can teach it to someone else. So I think one of the major aspects of our book is that our authors like to write about sort of things. They like to teach. Everybody's always in a teaching mood in the emergency department. There's always somebody to teach, medical student or res or even the nurse. So we're essentially doctor teachers, and that keeps you up to your best, keeps you on the cutting edge. Is to try to teach it or tell it to somebody else, you have to know it best yourself. You'd ask about some new features of this book. I think there are two that really stand out in addition to all the additions and tweakings we've done to the previous versions. One is there are numerous almost mini atlases there of a procedure, so it's all in a single box that looks like it's done just for that procedure. So as I was told by one of the doctors who looked at it, says, I can take this right to the bedside and sit it next to the patient, and I don't even have to take my gloves off to turn the page like we used to have to do to go to see the different sequences. So everything is right there as in one plate or one procedure box. The most exciting is the addition of videos. Of course, it's easy to write about something, and it's very hard to really explain it through static pictures. We now have numerous videos for a number of procedures. Someone wants to learn how to do a lateral canthotomy, which is a very technical procedure, hard to show on static pictures, easy to show on a model, and a lot of our videos will be actually on real patients. Some of them are in the laboratory on cadavers, but the video portion of it is the cutting edge that really tweaks it. I think most people will think the video portion are worth owning the book for, knowing the website to go for, so they can actually see it done as opposed to trying to figure out with the words. So see it once, read about it 10 times. I think it speaks for itself.